Okay, this is the Professor, CBMD PhD, and today's Thursday, October 5th, 1923. It is 11:37 and 2 seconds, AM Eastern Standard Time, and today's research, bladder cancer. So let's hop to it here. Advanced bladder cancer. Patients can keep their bladder under new treatment regime. Clinical trials show an approach combining chemotherapy and immunotherapy can help preserve quality of life. Date October 2nd, 1923. Source: the Mount Sinai Hospital. Investigators have developed a new approach for treating invasive bladder cancer without the need for surgical removal of the bladder. Removing the bladder is currently a standard approach when cancer has invaded the muscle layer of the bladder. In a phase 2 clinical trial that was the first of its kind, doctors found that some patients could be treated with a combination of chemotherapy and immunotherapy without the need to remove their bladder. As surgical removal of the bladder can be curative in muscle-invasive bladder cancer, but the procedure can have profound effects on a patient's quality of life. The treatment for muscle-invasive bladder cancer is indeed of major improvements from both a quality of life and an effectiveness standpoint. If additional research confirms our findings, this may lead to a new paradigm in the treatment of muscle-invasive bladder cancer. As 76 patients participated in this clinical trial, and approximately 43% achieved a complete response. No detectable cancer when treated with a combination of chemotherapy and immunotherapy. And patients with a clinical complete response were offered the opportunity to proceed with additional immunotherapy without surgical removal of the bladder. Among patients opting to proceed without surgical removal of the bladder, about 70% had no evidence of the recurrent cancer after 2 years. And based on the results of this trial, 2 follow-up studies were launched to build on this approach. One is ongoing, and another will open in the next 6 months. And this is the Professor of Microbiology, Bioinformatics, Pathophysiology, and leader of research. This video was created for educational purposes only. Hope you enjoyed listening. Until next time, have a great day.